Put on the stuff real quick. I'll be right back.
Okay.
Hi, everyone. Is Dr. Patterson on?
Not yet.
Okay, let me try and find her.
But we were all coming off of the Teams.
Oh, okay. So she was on the
meeting.
Teams. Okay, no problem.
Yeah.
All right, thank you. Hey, Dr. Marsh.
Hey,
Hey, Kennedy, please do the countdown whenever we're ready to go, okay?
Okay.
Good evening, everyone. Are we ready to start?
We're ready to rock and roll.
We are ready to rock and roll. Well, I want to say good evening, everyone. My name is Dr. Michelle Nelson, and I am the proud director of the mighty Clayton State University. But most importantly, I'm an avid supporter and advocate here at the Urban League of Greater Atlanta. I have the distinct pleasure of serving as one of the individuals that curates these panels of very exciting speakers, along with my co-moderator, Michelle-Ann McKenzie, and our host, Mr. John Moy. Urban League has had a distinct commitment to health and wellness. And through this forum, a symposia that discusses pathways to better health, we have been able to bring some exciting speakers and experts to our individuals who join us. We're also very happy that we are going to be able to discuss the state of healthcare in Georgia, barriers, solutions, and leadership in uncertain times. We are most certainly in uncertain times, and we're looking forward to our discussion this evening so that we have a better sense of how to move forward when it comes to healthcare. Mr. John Moy, before we get started, would you like to bring greetings on behalf of the Urban League?
It would be an honor to do so, Dr. Nelson. I don't know if I'm on camera or not, if you can see me.
I can.
Good deal. All right. Well, good evening, everybody. And on behalf of President Nancy Johnson and the family at the Urban League of Greater Atlanta, and my good friend and moderator, Dr. Nelson and Shelly-Ann McKenzie, thank you all so much for joining us here this evening. Our journey began together, Dr. Nelson and I, a few years ago when we embarked on the State of Black Georgia tour across the state. And we took time out under President Johnson's leadership to do a deep dive on what's going on in our community. We began here in the Atlanta metropolitan region, And then we toured, if you recall, Dr. Nelson, we went to Albany, Georgia, and Macon, and Augusta, and Savannah, and Columbus. And we came back and produced a 132-page report. But Dr. Nelson took the leadership in terms of healthcare. And so she wrote the healthcare sections. She was our subject matter expert, and we learned so much of what we already knew, and so much additional information that we didn't. But we all came to the conclusion that we needed to bring this attention to you, the people, to you, the listening audience, men and women and young people, about your healthcare and how we as your advocates can help you. So Dr. Nelson, thank you for the honor of joining you here this evening. I'm going to turn it over to my good friend, your co-moderator, Shelly Ann McKenzie.
Shelly Ann? Unfortunately, Shelly Ann has the flu this evening, and I don't even know if she's able to speak. So,
I am
Ann,
here
go
and
ahead.
I am here and I will say hello briefly and thank you so much for joining our panel this evening. I look forward to this riveting discussion and take it away.
Okay. Well, this evening I have the distinct pleasure of introducing our panelists. First, we have a very dear friend, Representative Dr. Jasmine Clark. Dr. Clark has been a pivotal fixture at the Georgia Capitol, fighting for a multiplicity of bills. But most importantly, she is a fierce advocate and supporter of healthcare legislation. Dr. Clark is going to introduce herself in greater depth when she speaks, but we are very pleased to have her here as the legislative voice for the evening, because we all know that what happens legislatively goes to the absolute core of our ability to live. Where we live, we work, we play, that is all undergirded by the legislative happenings at the Georgia Capitol. Then we have another great friend, Dr. Patricia Marsh. Dr. Patricia Marsh is an avid, I like to say about Dr. Marsh, she is like a social media impresario. She has got it hopping and popping on social media. Can I say that, Dr. Marsh? Well, there I said it, because she has done great work with her platform that she's going to talk more about, but she focuses on primary care. And so we're going to be speaking a lot about preventative medicine and things that you can do that are going to keep you healthy, because we're in perilous times, y'all, and you know it. So what are those things that we're going to be able to do? Then we have Dr. Donna Patterson, who rounds out our panel for the evening. I would like to say that she is the health and wellness and weight loss queen. She's going to tell you more about her weight loss journey and her fabulous practice and what it means to be an entrepreneur, specifically in Henry County, which is close to where my school is. But she has, with her clients, been able to lose a whopping set of weight. So all of you who are trying to get your summer body together, you better check out Dr. Donna Patterson. So we're going to go ahead and get started. And we're doing something a little different this evening. I'm going to be starting with a poll, because we want to be able to see throughout this series how well you are absorbing this content and if it's really making a difference to you, because the Urban League wants to make sure that we're delivering content that is going to go to the core of what it is you need to take the reins of your own health and wellness. My good friend, Mr. Moore, he says to me a lot of the time, only we can save us. So we want to make sure that we give you the tools. Do I have that right, John?
You're right, Dr. Nelson. The cavalry ain't coming to save us, my friend.
That's it.
We're all we got.
We are all we got. Absolutely. So, Kennedy, We would like to start with our first poll. So before we go into each of the different sections that are going to be led by one of our panelists, we are going to be putting up some polls, and we want to have you quickly respond to that poll. Quickly respond to the poll. And then we're going to show you where we fall. The chat is also open, so if you want to throw something in the chat for us to monitor and respond to, please have at it. If you just want to give a shout out and let us know that you're here and where you hailed from, we'd like to know that as well. All right, maybe 5 more seconds. Now, what have the people said? Oh, strongly responsible. So we're already on the right track. And as Mr. Moy says, the cavalry ain't coming, and we have to save us. So that means now you already know that you are keenly aware of your responsibility to yourself. We're going to get started with the first question to my good buddy, Dr. Jasmine Clark, Representative Dr. Jasmine Clark. This focuses on healthcare access and economic stability. In this political climate, Dr. Clark, where should we look for leadership as we see significant upheaval and the dismantling of federal funding agencies that impact healthcare access for the underserved and the underrepresented communities here in Georgia? What to do?
Yes. I appreciate the question. I want to thank the Urban League of Greater Atlanta for putting together this platform, because I do think that these are important conversations that need to be had, as well as Shelly Ann from Help for Healthcare Professionals. I hope you feel better. When it comes to where we should look, I think one of the things we need to recognize is what's happening at the federal level means that right now at the state level, which is the level of government that a lot of people don't even really talk about. A lot of people don't know we exist. I'll be honest, when I go and knock on doors, there are people that have no idea what a state representative even is. There are a lot of people, probably people right now this evening, who, if you were to ask them quite simply, who is your state representative? They wouldn't know, and they wouldn't even know how to look that information up. But at this moment in time, there is a systematic, piece by piece dismantling of the systems and departments that were responsible for a lot of the things that deal with healthcare. Whether that be access to healthcare, so we're talking Medicare, and maybe things haven't happened there yet. I don't know if things are going to happen, but there's the threat there. And with everything that's going on, I just am bracing for it. But not just that, we're talking about research, scientific research. A lot of times people think scientific research is just like someone sitting over in a lab, but scientific research is also public health research. Things like emerging diseases, this flu strain that we're dealing with right now that's pretty bad. The fact that right now, a bunch of farms all over the country, even right here in Georgia, are having to kill all their chickens because they have bird flu. And how does that affect us, as consumers and as people who eat chicken or eat eggs or, consume these things? There's so much information that was coming from the federal government, National Science Foundation, cancer research, study groups, all these different things have come to a halt as the chaos of what's going on. And so right now the states are really important. So when it comes to leadership, what I would say is that we need to know who are the people in positions such as myself, chairs of committees down at the state capitol and both the House and the Senate. Um, you know, who's running our public health system here in the state of Georgia. All of those things are very important for us to look to. But also, this is really a time where we need to lean on our organizations. And this is the time where there are lots of organizations out there that have our best interest at heart and in mind. And they are providing us with information. And this is the time for us to turn to them and say, there's chaos over here. There's chaos over here. I just want to take care of myself. I want to take care of my physical health and my mental health and the health of my family and health of those around me. What can I do? And so that's why I love platforms like what we're doing to now, because this is leadership. What's happening tonight is an example of leadership when it comes to making sure people have the tools, resources, and information to take care of themselves.
Mhm.
You're on mute.
I think at this point, we passed the plate, because you said a word. Representative Clark, it is so true that this is leadership. And in the absence of leadership, up until the end of last year, I felt like we had a North Star. We knew what we were working towards, we knew who to call, we knew the process. And right now, everything is so up in the air that we don't know where to turn. But what we do know is that, just like you said, we have organizations like the Urban League that can give us platforms to be able to get that information out. So, Dr. Patterson, what say you, Dr. Patterson?
Hi again, everyone. Personally, we as individuals have to step up as leaders because traditionally the people that we turn to as leaders are failing us. Not all of them. Not all of them. We have House representatives and state senators that are advocating on our behalf, but they're limited in what they can do. And so they need us to be able to help them to do their job. We need to show up and we need to advocate more. We need to let our voices be heard. We need to, sometimes they said it takes that one person to make a change. And of course, in this climate that we're in right now, it seems very, very challenging and difficult for any one person to stand up and really make a change because they don't want to be gaslighted or be targeted. But as a group, as a nation, we need to show that, we're not just going to roll over and give up our freedom, the freedom of choice, the freedom of being able to participate. And basically what I'm trying to say is that people are living in fear right now, and a lot of people are concerned about their well-being and the well-being of their families. But we can't just lay by the wayside and wait for it to happen. We have to stand up and we have to have these discussions like we're having now. Like Dr. Clark said, we have to make sure that our voices are being heard. We need to scream it off the mountaintop if we have to. Otherwise, our voices will be taken from us and we won't be able, the media is maybe taken from us and we won't have the platform to be able to voice our feelings or thoughts or opinions and the injustice that we think is happening in our nation, whether that be for middle class, lower class or undeserved population. We just have to do something different.
Something I was thinking of, Dr. Patterson, before we get to Dr. Marsh, is something that I want everybody to know, that health and wellness transcends parties. Okay?
Yes.
So I don't care what your political stripes on this call are tonight, because child, I have seen it all. What I want people to know is that, and I tell them this about myself, I'm the party of nursing.
Yes.
I don't want you to try to figure out if I'm a Democrat, I'm a Republican, independent, stripes, paisley, or polka dots. My job, not that I don't have my own personal feelings as to what should occur, but I am concerned with health and wellness for everyone, and we must have united front, because without health, we don't have anything. This is not Bitcoin. This is not lawyering. This is not transportation. This is not education. If you don't have your health, you don't have anything.
Yes.
And so we have got to find a way, unified for this cause, to make sure that we are standing together and that we are educating our legislators, because Dr. Clark will tell you, not everybody knows about health. She does. But we have people that sell insurance, we have people that are in agriculture, we have opticians, we have obstetricians, we have every type of issues down at the Capitol. And so we have to be the ones to educate them on what our needs are. And
Yes.
they're going to respond to that. They have run for office vigorously. This is no joke, running
Yes.
for office. And they want to do their best, but you got to show up and you got to educate them to let them know in a nonpartisan way, because you care about everybody. This is what our communities need. Would you
Yes.
agree, Dr. Marsh?
I absolutely agree. I know that healthcare is it's a civil right. Everyone on this call, everyone in this world has the right to healthcare. And I think when you have the breakdown of leadership, especially that which we see on the federal level, we have to find leadership, as we said, in us standing in the gap of injustice and poor changes, and social determinants of health and inequities worsening within our communities. I think we have to refuse this injustice. And the way that we do that, if we can't write a white paper, if we can't petition, we can retweet, we can repost, because as Reverend Kendrick Lamar said, you can't fake influence, and there's power in influence, and there's power in the people. And we see it as we've seen in the past. We need to learn how, when the powers at hand are against us and they are perpetuating policies that are negative towards us, we have to coalesce and come against it together. And so I know that that's the way forward. That's the way that we show those with the titles of leadership how to really be leaders in effective change.
Dr. Marsh, I like the way that you reference the good Bishop, Dr. Reverend Kendrick Lamar.
Yeah,
They not like us.
they're not
Okay.
like us.
They not like us. And we have to make sure. And something that you said that really jumped out at me is we have to refuse injustice. That's powerful. I refuse injustice. So you throw it at me, I take it and lob it right back at you. I refuse to accept injustice. We got to add that. That is I'm writing that down. That's powerful. Refuse injustice. So I can listen to it. Doesn't mean I have to take it in. And I can say, I will not go for this. Refuse injustice. It's a great one.
Right.
So, Dr. Marsh, I'm going to roll into the next segment with you. And that's going to focus on health equity, social determinants, and social justice. But before we go into that, we have our next poll. Kennedy, I love these polls. This is fun. Kennedy? Okay. How confident are you in your ability to navigate the healthcare system? Choose one. Single choice. You know, you never know which way these things are going to go. It's always a surprise. Maybe 5 more seconds, Kennedy. Okay. It's a mixed bag here.
Mhm.
That's what I expected to see. With a lot of people very confident in their ability to navigate the healthcare system. And so that's something that we'll need to jot down and we'll focus on for maybe our subsequent forum, how to increase confidence in navigating the system. Okay, so that's very good. Dr. Marsh. And actually, you know, I think this goes into legislation, which is actually Dr. Clark, but I wanna see what your thoughts are. What legislative actions in Georgia do you think are needed to integrate social determinants of health funding into public healthcare programs to address disparities in housing, transportation, and food security? Do you think that there are legislative fixes needed?
Oh, yes. So I think our legislators have to understand what social determinants of health are. And as you stated, social determinants of health define like where we work, where we live, where we play. And it actually accounts for 80% of our health outcomes. And so we have to start taking these determinants very seriously, and they include things about how much money do you have? Do you have economic stability? What's your education level? What's your education access and the quality of that education? Because you have to start understanding things in a healthcare realm. And then you're looking at healthcare access. How many clinics are around you? Are there hospitals around you? Physicians around you? What specialties are around you? Do you have insurance coverage? That's one of the most ways most Americans gain access to healthcare. And then it's going to look at your neighborhood. How is your neighborhood built? Is it safe? Are there sidewalks? Are there parks? Are there industrial plants that may make your environment exposed to toxic chemicals? And that could affect your health in the air that you're breathing. And then it goes into social and community context. So this is looking at like discrimination and what you're facing. Is there violence nearby? Are there additional stressors outside of your home? So when we're taking all of these social determinants of health into factor, we have to include them when we're writing out policies that have to deal with public healthcare programs. And I think one of the actions that our legislators have to do is they have to start mandating, codifying this. We have to know what these social determinants of health are, what the zip codes are, and that way we can have social determinants of health interventions that are strategically targeted in those zip codes and bring in the support. So nutritional support, housing support, transportation support, because that's one of the social determinants of health. Do you have access to transportation? Can you even get to where you're going to make the money that you need to pay for your health care? And so as we look at federal decline, I think we in the private sector and in the public sector, we have to start coming up with secondary solutions and saying, okay, If our state, as Georgia, decides to be like the federal government and cut funding towards public healthcare programs, then what are we going to do? And so now you're talking about partnerships in the public and private sectors, because we know the private sector, the money got to make sense. So if they're not getting tax incentives, if they're not getting, incentivized involvement in these social determinant of health initiatives with the government, it's not going to be as sustainable as if we had all hands on deck. And then we got to go to boots on the ground. Urban League of Greater Atlanta, coalitions, faith-based organizations, boots on the ground, the people who knock on your doors, the people that we saw who were there for those victims of the fire in Los Angeles. Those were the first persons that were there, not the federal government, not FEMA. They weren't there first. It was your neighbors. And so we have to take into account solutions that incorporate them. And so I think our legislators have to tap in private sector with public sector, with community-based organizations, and understanding where those needs need to be specifically based off of zip codes, because we are leveraging that data and making those programs targeted.
Dr. Marsh, excellent response. Something that you said that jumps out at me is using funding within the private sector and coalitions, how everybody can work together to be able to get this work done. But something that just doesn't sit right with me, or with any of us, is we're doing this work on behalf of the most vulnerable, which typically tends to be individuals of color, and trying to equalize and level a playing field.
Mhm.
How can we do that work? And Representative Clark, maybe, what are your thoughts on this? How are we going to do the work when you can't say it? We still got to continue this work, social justice, and I'm going to say work. Maybe I'll whisper it. We're going to continue the work without appearing to continue the work or saying it. How do you do that and don't get dinged and get slapped on the wrist?
So
Representative?
I think that's a good question. I want to start off by just kind of piggybacking on some of the social determinants of health, and also say that sometimes you can say the thing without saying the thing. I have colleagues that have a knack for taking a word that means one thing and saying it a whole bunch of other times, and now it means something completely different. So a couple of things. While I do know that there are certain words that have now become dirty words, I actually feel like this is a time where instead of using acronyms, we use our words. I really think that it's important for us to recognize that when you are anti-DEI, that is the same thing as being anti-inclusivity, anti-equity, anti-diversity. And if you're going to be anti those things, say it loud and proud. Don't hide behind 3 letters that are amorphous and easy for people to not associate with what they actually are. Additionally, when it comes to certain social determinants of health, our legislature has a long way to go. Right now, there are so many Georgians out there. We are actually one of the worst in the country for uninsured rates. And there are so many Georgians that they're barely able to put food on their table, let alone think about health insurance. And here's the thing. These people, they are trying to thrive. They are trying to live. They want to do what's best for themselves and their families. But if they get sick and someone says we need to call an ambulance, I hate that this is the way this is in our state. There are people that will absolutely refuse an ambulance because they don't want the bill. Like, they are more afraid of going into medical debt than dying of a heart attack or a stroke. they need care, but they are worried about their bank accounts. That is not the way a civilized society should be. I also want to point out we can legislate more public transit, more walkability. We can put budget items into our budget that prioritize these things. Because here's the thing, walkable cities don't just increase access. It'd be lovely. I have a grocery store a mile away from my house. I would love to be able to walk there, but there is no sidewalk. And it is too dangerous for me to walk there. I would love to be able to do that, not just because I would like to be able to walk to the grocery store. That's access. It's exercise. I can save a little bit of money from cranking up my car while also saving myself, get my heart rate up, getting to that store, burning some calories, and doing what I need to do for my health. I also want to mention earlier today, I had the opportunity to join Urban League of Greater Atlanta to talk about House Bill 60, which is the school lunches. Quite simply, feed kids. We're not asking for much. I think when we talk about partisanship, if there's one thing that we should all be able to agree on, it's kids should be able to eat. Here's the thing. I used to have a friend who, when she would introduce herself, she would say, "Hi, my name is XYZ, and my biggest regret is that I didn't choose better parents." And she said it in jest, but the truth of the matter is, children are not, they are born into a circumstance, whatever that circumstance is, they are blameless in this. We should not be telling children, you deserve to be hungry because your parents aren't doing. Children don't have anything to do with that. Feed kids. It's as simple as that. And then other thing I want to bring up, we talked, Dr. Marsh talked a little bit about, living in industrial areas and how that affects you. We need a lot more legislation on corporate accountability, because it should not be okay for a place like BioLab to just completely pollute an entire community. And it's just kind of a slap on the wrist, like, oh, sorry that happened. And while I do recognize that BioLab is trying to do right, a check doesn't fix the health issues that might be long lasting from having, a chemical fire in your community. And so those are some things that I want to talk about, but I want to just round this out by saying I'm not afraid to say diversity, equity, and inclusion. And I think that we need to say it more often. Maybe we have to say it, break it up. Maybe you have to say diversity in one sentence, equity in another sentence, inclusion in another sentence, so you don't say them right next to each other, so you can get around the rules. But we have to say these words out loud, because I challenge any of my colleagues to say they're against diversity out loud. They'll say they're against DEI, but they will not say I'm against diversity out loud, because that does not sound good. They will not say I'm against inclusion. That does not sound good. I'll be honest, some of them will say they're against equity, but most of them won't. So these are the types of things that I think we need to do. Social determinants of health are about these things, but I also think social determinants of health have to do with some political determinants of health, like who's in leadership in your state and the types of policies that they're implementing or not implementing in your state.
Absolutely, Representative Clark. Very, very well articulated. I don't know. Dr. Patterson, I might have to brush off my Pig Latin book from when I was a little kid. That way I can say diversity, equity, inclusion, dipse, ipse, lipse, I don't know. Find another ways to say it, but I'm going to make sure that my courage meter is way high, and that just in the name of justice, that I'm using my words appropriately, loud, and strong. Dr. Patterson, what say you? Your thing is not
Of
on.
mode. Okay, I'm off of mute. And this is the problem we're facing, because people, again, I go back to the word of fear, because we are now becoming fearful of saying the words, fearful of getting into trouble, fearful of being targeted. But in this climate that we are in, we need to ensure that we are prioritizing the things that are important, not just for those that are of the upper class, but those that are undeserved or undeserved community. We need to ensure that we're establishing dedicated, I think when legislation should establish dedicated funding that is either state mandated or city mandated to where these fundings go towards the projects of housing, transportation, healthcare costs. Because like you mentioned, like Dr. Clark mentioned, I work in a hospital setting, and too often I see patients coming in to the hospital. They're told they're having chest pain or whatever the circumstances are. They're either refusing the ambulance transport or they choose to drive themselves because of that bill. And I have done it before. So I know I've gotten an ambulance bill before, and I said, never again. And so when we don't have things that will make us feel secure, the food, we have food insecurity, we have housing insecurity, the transportation, not having access to the care that we need. We're talking about health, but not having access to the care that we need to prevent diseases, prevent heart attack, prevent stroke, to get the vaccinations, to prevent the pandemic and the epidemics as we're having an outbreak, then we're setting up our communities for failure. So it is important that we are establishing statewide, because each state needs to take care of its own constituents. Statewide, that the funding is put in place to make sure that our community, those in the rural areas, can get access to their vaccination. They can't come to us because they don't have transportation. How about we go to them?
That's right.
How about we have a bus? You used to have this this bus, like a dental bus back in the days, that would go around to small communities and do dental care and even do eyeglasses. I don't know who's doing that anymore, but why don't we have those programs in place where we're targeting these communities and educating people, because of the fact that we have people are lack of education, lack of knowledge, fear of the healthcare system because of past history and past things that have happened in the past. People just feel like if I'm not sick, if I'm not dying, I don't need to go in and get checked up. I don't need to go make sure I don't have high cholesterol because I'm not having chest pain. I don't need to make sure I'm not diabetic because I feel fine. Too often, just in terms of hypertension, so many people are walking around with high blood pressure and don't even know it. And it's not even those that are undeserved, it's all of us, a lot of us. So how can we get access to care from a legislative standpoint? We need to create the funding first and foremost, because nothing can be done. The needle can't be moved without the funding, to make sure that we're including these undeserved communities and ensuring that they are getting the healthcare services that they deserve and that they need.
You know, Dr. Patterson, something that we have to understand that with all this upheaval and topsy-turvy craziness that we're seeing, at any moment, we can all become underserved and
Yes,
vulnerable. Nobody is safe.
that is true.
Nobody.
That is true.
You could be the person with that 30-year career, thinking that you're about to retire with a nice cushy
Retirement.
retirement, and they say ta-ta.
No
What?
job.
No job.
No job.
So we're all just one catastrophe away of being this underserved, vulnerable, uninsured. Where are these people getting insurance? I
That
mean,
part.
my goodness.
Yeah.
So we have to take these things, we can't take it lightly, because it's all of us, no one's safe. And the cavalry is not coming, as Mr. Moy will tell you. This leads us to our next poll. Kennedy, the next poll. As we get into preventative care, chronic diseases, and vaccine equity. How confident are you in your healthcare provider's ability to keep you healthy?
Not confident at all.
I don't want you just thinking about doctors. I'm all across the board, PAs, advanced practice nurses, doctors, everybody. The hospital you go to, the urgent care, the big health systems, the small mom and pop practices. We've got some work to do. Because confidence is low. But remember, confidence was high in our ability to navigate the system. But although you can navigate the system, you're not confident that that the system is going to meet your needs. That's a problem.
Yes.
I know how to work it, but it may not be working for me. Dr. Patterson, why
Yes,
do
ma'am.
underserved communities in Georgia experience lower participation in preventative screenings and vaccinations? And what locally driven strategies do you think we can engage in to get that engagement high?
Well, this ties into the SDOH, the undeserved, what we were just talking about, the undeserved population, because we have limited access to healthcare. One, because you mentioned lack of insurance. We have limited access because of financial constraint. People cannot afford to go to the doctor. They cannot afford to pay for insurance. They cannot afford food, the basic things that they need to take care of themselves, or they cannot afford the medication that they're being given, the life-saving medication. You will have people who are on a drug that costs $8,000 a pill. I had one client in a hospital that was on a medication for pulmonary hypertension. It cost $32,000 per month for his $32,000. Of course, he had insurance that was covering it.
That's not American dollars. It has to be Jamaican dollars. And
$32,000 per month. And this patient was rationing his medication instead of taking it twice per day. He was taking it once daily because he did not want to run out too quickly. And so he ended up in the hospital in a terrible condition. And so, in addition to that, there's mistrust in the healthcare system. Confidence is low. We don't trust that the people that are supposed to take care of us, supposed to educate us, are doing a good job. The healthcare system is more reactive versus preventative. And so that becomes a problem. I don't want to wait until my leg's about to fall off to get care. I want someone to teach me how to prevent diabetes, how to prevent renal failure, not just give me a pill to, keep going until I have no leg left. Insurance companies are willing to pay to cut your leg off, but they're not willing to teach you how to prevent diabetes. So preventative education is also important. Back in the days when we used to have the Tuskegee experiment, that causes people in the undeserved communities or people with lower income to not trust the system because they're afraid that this may happen to them as well. They may be harvesting their organs or something. And that is very important. Education, educating, educational barriers, cultural barriers. We have the economic standpoint and economic barriers and lack of awareness and education. Education is a big key component to ensuring that we're able to get access to care, to the vaccination. A lot of people don't want their kids to be vaccinated because they don't trust that these vaccines are safe. And so that poses a problem. If I don't trust that this vaccine will not give my child autism, I'm not going to want my child to have it. Now that becomes a problem within the system on a whole. And so it is necessary that we're educating, and bringing awareness to the importance of having access to these healthcare services so that we can have healthier communities overall.
Dr. Patterson, that is so true. When you talk about access and you talk about, you know, fear, and you talk about all these things, you just wonder, how are we as individuals of color going to want to engage? I can tell you this. When I was a doctoral student at Emory, and we of course studied through humanities and ethics the issues with the Tuskegee syphilis experiments, you know, people of color may not know what the heck happened at Tuskegee or where it is, but they know Tuskegee.
Yes.
That is ingrained in us.
Mhm.
So there is such a deep mistrust of the medical establishment,
Yes.
and we don't engage in studies, and we don't want to go to the doctor, and we don't want
Right.
to do all of these things. And, you know, it's just having to overcome the racism, the injustice, all of the isms that have kept us back. And I tell you
Mhm.
what, it seems like we're being dragged back. They're dragging us back,
Definitively
but we
so.
cannot slide. We have to make sure that we as a people are moving forward, and not just people of color, all of us.
Yes.
Because, like we said earlier, healthcare should not be a privilege, it should be a right for all.
Yes.
Dr. Clark, what is your response to this?
So I want to echo a lot of what Dr. Patterson said. It's true. I actually had a conversation with someone. I was talking about, I think I was doing a panel for HIV, and we were talking about just getting tested. And they said something to me to the effect of, it's better to not know, because what's the point of me going, getting tested, getting screened, finding out I have it, and I know I cannot afford that medicine. And that is something that has always stuck with me, how the decisions that we make are an ecosystem. They don't just affect one thing, everything touches something else. I'll tell you another very quick story. I have a son, he is a freshman in college. He was having some flu-like symptoms, and he contemplated going to student health. And then I said, go ahead, go to student health. Maybe they can give you something for it, or at least they can test you and see if you have the flu. And he said, Mom, I really want to go to student health, but right now, if anyone sees you going into student health, they assume you're going there for an STD, and I don't want that attached to me, so I'm just gonna ride it out. Stigma is so harmful, and I don't think we talk a lot about stigma. You take the distrust of the medical community, you add in a sprinkle of stigma for those who do actually seek health care. And then to put the icing on the cake, you have the misinformation and disinformation of podcasters and, like, literally our now Secretary of Health and Human Services. Like, you take all of those things and you put it in the oven, and what you get out of it is the situation we're in, where underserved communities are not being served, and they are not even seeking out healthcare. So I agree with mobile units. There are opportunities to take mobile units into communities. If people won't come to you, come to them. health fairs like what Shelly Ann and Help for Healthcare Professionals does, having health fairs in the community where people can come and get free services and get free screenings and start themselves on the journey. I know in my community, I had a free screening for glasses. And do you know that was probably one of my most attended events just for kids to get glasses for schools? Sometimes we have to go to where people are and we have to be willing to have the conversation with them to debunk the misinformation and disinformation, to let people know that it's okay. Right now, there are so many Black men walking around with prostate cancer, and you know they don't know it. And you know why they don't know it? There's so many men that are so afraid of the test. They don't know that you can just get the PSA testing. They assume, oh, they're going to have to do something and, quote, violate me, and they won't get tested. And then, unfortunately, there are multiple types of prostate cancer, but Black men often get the most aggressive form. We've got to somehow get around stigma, and we've got to fight misinformation and disinformation. That's the only way that we're going to be able to serve. And again, I will scream it to the mountaintops. Organizations that come into the community and provide a service, they are so invaluable. You cannot put a dollar amount on how valuable they are to the community.
I just want to chime in.
Well, I want to share a little joke real quick.
Oh, go for it.
Something that I do with my husband. If you don't want to go to the doctor to get that prostate check, you know I can do it. I teach it. So let me go get my lube, and it's either I'm going to do it or the doctor will. Here's the choice. Listen, even you got to use whatever tactics you can. We as women and men who lead families, you set the tone, and sometimes you got to push for certain things. We have got to save each other. We have to. So take the reins of what's happening in your family, and you encourage your kids, and you encourage your spouses, and you say to them, look, if you don't go do it, well, I will. And I might not be as gentle as a doctor, so I think you better go see the doctor. Dr. Marsh?
Yeah, I think that's the biggest way to engage our community, is rebuilding that trust. And I want to thank Diana, Patrina, Shonda, Teresa, people who have been in the chat, telling about their experiences, because that is a part of engagement and a way to rebuild trust in sharing what has happened to you when you've encountered our healthcare systems, to even get, to the comfortability where you would go seek out preventative screenings and care. And to the end, for Dr. Jasmine that she was speaking about, we just had our annual heart health event on Saturday, the National Coalition of 100 Black Women, Metropolitan Atlanta chapter. And we had Northside Heart Institute giving free carotid ultrasound scans. There were free cardiology consultations from Emory's Women's Institute, completely free. And so the value that these kinds of events bring to our community, both engage and drive against misinformation, disinformation, and repairs and rebuilds that trust that our community has with us as providers. And I love that for us. So I want to encourage everyone. Shelly's put it in the chat many times that if you're available February 22nd, go down to Laudermilk and get those free access to care and preventative measures where you can see what your blood pressure is, you can know your numbers, and you can find out those resources in that same event that give away the treatments for free, or that give away the education that you need in order to do it yourself. Because I believe the good Lord has put food and water on this earth for us to take and optimize our care and prevention ourselves, not depending upon some policy that's a written promise that may or may not happen from our legislators, or monies that may or may not come into our vicinity, but our organizations, community-based organizations doing the work, engage with us to rebuild that trust with us and re-engage with us.
That is fantastic. Fantastic. I need to know when the next thing is, because I want to be scanned from my eyeballs down to my to my feet.
May 10th, May 10th.
Oh, May 10th,
I'll put
where?
I'll
You
put
gotta
the information in the chat.
Oh, please, everybody, run, don't walk. Fabulous. So let's put up the next poll. Kennedy. How knowledgeable are you about the standard annual healthcare screenings recommended for your age group? Is it time for a colonoscopy? Is it time for a mammogram? Prostate and testicular checks. Everybody know when they're supposed to be doing that stuff? Kennedy, what's our responses look like? Oh, this is a knowledgeable group this evening. Very good. I'm encouraged, and I'm happy to hear that. So I want to move to the next thing, and the role that technology and innovation play in what we're doing. Dr. Marsh, how can Georgia lawmakers invest in expanding telehealth infrastructure and broadband access to improve healthcare delivery in rural and urban underserved communities? And before we even talk about that, is it important?
And tell us some of what you're doing with your work.
Yeah, everyone knows throughout the pandemic, we knew that telemedicine was essential to healthcare delivery. It was the only mode of healthcare delivery for a good amount of time. But to those without broadband access, it actually highlighted the inequities that we have. So people in rural areas don't have access to the internet like people in more urban areas. And so without that, it became more so as a healthcare delivery as a privilege rather than a right. And so I think Georgia actually ranks amongst the lowest states in the US for broadband coverage, especially in our rural Georgia areas, which account for more than 30% of the state. So you're talking about over 30% of the people in Georgia don't have adequate access to the internet. That's a huge disadvantage. And so we know that they're cutting back the federal funds on the Affordable Connectivity Program that they had in place over COVID and that they extended. And there was a Rural Digital Opportunity Fund that they had set up that's also being defunded at this time. So the state of Georgia has a lot of work to do to build its own infrastructure. And I like to always tap into where the money is. Like, yes, our states have a large budget, but sometimes the state's budget appropriation has been redirected to other things. And so I know in this case, we have to tap into those huge technology companies that are valued at trillions and trillions of dollars, that they can utilize those incentives to work with the large tech firms in order to build out our broadband infrastructure. And one of the examples that I actually learned about today was in Chattanooga. They actually partnered with a private company in order to extend fiber broadband across the entire city. So that's a more urban area, but the gist of it was launching a fiber optic internet program here in our rural areas in order to make access to broadband internet affordable and high speed, because it becomes way more high speed than utilizing the big names, you know, the Verizons, the Xfinities, et cetera. And so we have to do that. And we talked about bringing healthcare to those individuals in those spaces. And I think the telehealth kiosk that we've seen pop up in the last couple of years and the mobile clinics, we have to get those out and mandate that those go down on a frequency level that is comparable to that of regular care for patients that are in those rural areas. And that way they can have the satellite internet connections and have that access to telehealth. And then I'll talk about, you know, the laws that are fluctuating back and forth on the federal side, but on the state side, we need to make sure we're expanding like licensing for other companies outside of Georgia. If the Georgia companies aren't going to do it, we need to get those out-of-state providers of telemedicine on board so that they can help increase the infrastructure of telehealth access to our rural and even our urban areas. Some people don't have internet in their homes and they live in the city of Atlanta. So that would be something that we need to make sure we keep our mind on. And then individuals like myself, so I'm a physician, but I own my own telemedicine company. We have to start thinking of solutions where we can still reach patients even if they don't have access to internet. If they have access to a phone, we need to meet them where they are. And so Ask Me Your MD is able to give telephonic consultations. And so we need to expand that kind of care on our side within the healthcare industry so that we can maintain the health and close the disparity gaps for our rural patients.
Phenomenal. It seems like everybody and their mama has a phone,
Yes. Yeah.
right? But we're not necessarily in those deep rural areas where people really don't have anything. And the next person lives not next to you, far away, and there's no way to I mean, just a mess. And it really is sad to say that Georgia seems to excel at being in the bottom 10th of everything. And that is problematic. Would you not say, Dr.
I
Patterson?
definitely would say.
Highly problematic. Dr. Patterson?
Me and this mute button. Well, I believe absolutely that it is necessary and important that people in rural communities have access to telecommunication devices. Yes, it may seem like every baby and every toddler has a tablet or a phone, but in the rural communities, it is not necessarily the case. And because of the distances, recently I was reading something. It says that in Georgia, about 12 different hospitals closed since 2013 to now. So in 12 years, and most of these hospitals are, if not all, are in rural areas. So now we're having the fact that we don't have the access to the care anymore. And the next best thing is trying to use telehealth or telemedicine services. But if they don't have the devices that are necessary and the broadband access, the Wi-Fi and the internet, then that makes it very challenging. Because it would be nice if you could pick up your phone and call your doctor and have a conversation. But what do you do when you don't have a cell phone? What do you do when you may not even have a house phone? So now we need to talk about getting these things in place where funding is put in, and I'm back to funding again, where funding is set aside to ensure that rural communities have access to communication devices so that they can get the access to care that is necessary. Because without the care, they're just gonna die. Cancer, heart disease, all of the different diseases that when you don't get care, you literally just sit and die. So state legislation, whether it be the governor, whoever needs to make sure that this is mandated, that we are taking care of our rural community as much as we're taking care of those in the urban areas. And this, we may have to go out, the Urban League may have to go out and have a phone drive. You don't need this old cell phone, donate it. And instead of sending it, trading it in, we donate our cell phones to the local underserved community so someone can have access to that. Telecommunication companies, whether it be Verizon or Comcast or otherwise, can offer low to no cost phone services to these areas. It could be a $10 per month bill instead of a $200 bill. There are things that need to be put in place to ensure that access is available. And without the access, then people have to travel long distances to get care. And if they're not able to afford the costs necessary to travel long distances, they don't have the insurance. You go to a doctor, you need an echocardiogram, but if you don't have insurance, a cardiologist will not see you. You know, how can they get the care that they need other than just the basic physical examination? What if you're having a heart attack and you need life-saving treatment? If you don't have the insurance, you cannot see a specialist. If you have seizures, you cannot see a neurologist. Or just getting a neurologist, talking to a council lady yesterday, she mentioned that she's trying to get an appointment to see a doctor, and the appointment is next year, the next availability. Next year, I told her, I said, you need to throw around your title because you need to see this specialist and it's a year out before you can see him. That does not make any sense. And so it is even worse in the rural areas if we're experiencing those things here in the urban area. So we just need to do better as a whole, as a community, as Georgians.
Dr. Clark, we must do better as a community, as
Yes.
leaders,
I
as
agree.
Georgians.
Yes.
Our time is coming up, but I want to hear a response from you before we move into the next section.
Really quick, I would just reiterate what Dr. Marsh and Dr. Patterson have said. I also want to point out that a lot of times we talk about rural areas not having access to broadband, and that is definitely an issue that we have here in Georgia, an issue that since I have been in the legislature, we talk about it every year. I am now in my 4th term, which means I'm on year 7. We still haven't fixed it. We just talk. There's a lot of talking happening without actual fixing happening down in the state legislature. But another thing I want to point out is while yes, rural areas do have a significant lack of access to broadband, to internet, I have people in my community that don't have internet access either. We saw this during the pandemic. You know, I have, this is not me bragging, this is just me being honest. I have several electronics in my house. I have a laptop, my child has an iPad, I have a work laptop, a home laptop, and a capital laptop. I got laptops going all over the place. Every single person in my household has a phone, an iPad, an Apple Watch. There are households just down the street from me, they don't have a single computer in their house. So even if telehealth is available to them, the technology to use it is not necessarily available. And even if they did have a laptop, of all the things they have to prioritize in their life, they're not paying Comcast for the internet, and they're not paying for internet access. During the pandemic, we had kids going to McDonald's and Starbucks to do their work because, and by going there, because these places were closed, sitting outside of the parking lot and of McDonald's and Starbucks to do their work because they don't have internet access at home. schools had to provide wireless hotspots to students. We did, I want to say it was Xfinity. I'm not exactly sure who. Xfinity, whomever it was, did offer a free internet access bundle for students for that short amount of time, probably due to a federal grant or something like that. Either way, like, this is an issue. Access to rural broadband, access to internet, it's actually an economic issue as well as an infrastructure issue. So I just wanted to point that out. I wholeheartedly agree that access to telehealth expands access to healthcare, but that still leaves a significant portion of our population out of the formula.
It surely does. It surely does. And, you know, I like the fact that you guys have brought out quite a few solutions on how we can remedy the situation. Everything from using a legislative fix to having a phone drive and recycling our used devices. So we've got to come up with something. Our next poll, Kennedy. What's the biggest barrier to healthcare in your community? Responses? Lack of insurance.
Okay, okay, yeah.
There's gonna be a lot of people who are gonna be uninsured pretty soon, losing jobs, so this is gonna be exacerbated. Unfortunately. Dr. Clark, this next question is yours, focusing on policy, advocacy, sustainability, and accountability. What role do Georgia's hospitals, state agencies, and grassroots organizations play in ensuring the long-term sustainability of equitable healthcare access?
So this is such a big question to me because I think that there are just so many things that need to happen that maybe aren't happening or aren't happening adequately. I do think that I'm going to start with our state agencies and honestly, even our state legislature. We have to expand access to care, and that means number one, we have to get ourselves off of this list of being in the bottom when it comes to insured individuals. People need access to healthcare, and that involves having the ability to pay to go see their doctor and to get their medications and things like that. Georgia is one of the few states, again, not a partisan issue. One of the few states, both red states and blue states have done this, but Georgia is one of the few states that has not expanded Medicaid. And for those who don't know what that means, expanding Medicaid just simply increases the income level at which you are eligible for Medicaid from 100% of the poverty level to 138% of the poverty level. Believe it or not, there are hundreds of thousands of Georgians that fall in that gap between 100 and 138. And also, let's be clear, because a lot of people say, well, I don't like Medicaid because I don't want my money going to people who aren't working. Here's the thing. If a person is not working and they have $0 in income, they can get Medicaid. The people who are in this coverage gap are people who do go to work, but they're just not making that much. They are living paycheck to paycheck, but they are going to work. These are people that are working, And if they get sick, a lot of times they're working the types of jobs that don't have leave. So when they get sick, if they don't go to work, they don't get paid. So this is what we're dealing with when it comes to expanding Medicaid. It's something that we need to do. And I would love for more state agencies to actually acknowledge that that is what we need to do. The other thing I want to say is in this current climate where we are seeing a lot of negative information about vaccinations, vaccines that have been around for literally decades, life-saving vaccines that have caused certain diseases to not even be a thought. All of a sudden, we're seeing the reemergence of diseases that no one gets anymore. Like I'm not going to tell my age, but I'm in my 40s. I don't think I've ever met a person who had measles because since I was younger, we all got the measles vaccine. We are now seeing cases of measles happening in certain areas and certain populations, and that just shouldn't be happening, and not just here in Georgia, all over. So I do think that our Department of Public Health needs to be clear on education campaigns about the importance of vaccination and also the importance of preventative health care. And then I will leave it with the grassroots organizations. You all are going to play a very pivotal role, especially with all the chaos happening with funding and everything going on. Right now, people are just looking for answers and they're looking for anchors. And I would love to see our grassroots organizations step up to the plate and be those anchors for people so they don't feel like they don't have a place to go. So I wish I had a better answer, but I just feel like there's so many things happening and there's so much responsibility and accountability to go around. But yeah.
Dr. Marsh, your thoughts on accountability and access to care and the role
Yeah.
organizations play?
So I definitely think access to care is a universal right. I think the way that we do it is by becoming innovators. We have to become innovators and we have to become self-health advocates. And what I mean by that is just knowing your health most personally and more personally than that of your own primary care provider. Knowing what is going on inside of you, I think it's one of the best ways you can advocate for yourself and mobilize yourself within the healthcare community. I was quite surprised at the high confidence of navigating the healthcare system because outside, I'm like, this looks like a hot mess. This system of sickness, it's like, I can't imagine anyone navigating it and becoming better without having some foreknowledge, you know? And so I'm very confident that with organizations like the Urban League of Greater Atlanta, like community-based organizations, and even faith-based organizations, we can come together to self-advocate and get the access to care that we need without being traditional. And so I want us to kind of keep that in the back of our minds when thinking of solutions.
Dr. Marsh, fantastic thoughts. Dr. Patterson, what say you before we go into our last question?
As Dr. Patricia just said, education is important. Education is important. Yes, we have to be aware of our individual health conditions, what our bodies are telling us, and we have to take the necessary steps in order to self-treat if so be it. We don't necessarily need a medication or a pill to fix our problem. What we need is to learn how to be healthier and to live healthier lifestyle so that we can alleviate some of the diseases that attack us. Of course, we can't prevent pandemic and COVID and all of those things. When those happen and the things that are unavoidable like cancer, you do need access to care. And so now it becomes necessary that we as a whole, we need to make sure that we are helping in any way we can someone else. As a healthcare provider, I just launched this program called Healthy Henry. And it is to help Henry County residents in the community get healthier. And so we set a goal of helping Henry County residents lose 10,000 pounds. Because if we are, obesity is one of the main factors that is the foundation for many of the diseases that we face, including certain types of cancers. And so if we have a healthier community, whether it be we're planting vegetable gardens or we go for walks in the park or we do different activities to promote mental health and so forth, whether it's a reading club, we are essentially advocating for each other's health. And we're helping each other to become healthier as a community. If your community is healthier, then it's a lower cost of healthcare expenditure for the city. They don't have to be coming up with all this money to put into the clinics and the health centers. Instead, they can put money into healthier living, parks and walking paths and so forth for the community. So I believe that it is necessary, one, that we are paying attention to our own health, making sure that we're choosing healthier options, such as instead of having pizza on a Friday night, how about we have something else, a lighter, better option, that we're educating each other, that we're advocating for one another, and that we're supporting each other along the way. It's not just about me, it's about reaching backward, reaching a hand and helping somebody on their journey. And in turn, that person can help someone else on their journey, and it continues along the way. But as a whole, as a community, the grassroots organizations, of course, play a significant role, because as individuals, we don't have the income, we don't have the funding to be able to help on a wide scale, the amount of people that need help. And because Georgia does not have expanded Medicare, which would provide access to more people, now the access to care again becomes limited and the cycle just continues. So through community advocacy, through organization again, such as the Urban League, through different organizations in the community, churches and so forth, we can make a difference.
Dr. Patterson.
Can I
Yes.
just add one
Yes.
thing?
Yes,
As
Dr.
everyone
Clark.
was talking, I realized one of the things I would love to see grassroots organizations do: tell the legislature what the people that you advocate for, the population that you advocate for, the people that you're helping, tell us what you need. And I mean, like, physically get in our face and tell us what you need. Call us out to the ropes. Come visit us in our offices. Call us, email us. We actually need to hear. I can tell you right now, there are about 4 bills that are blowing up my email inbox right now. None of them are healthcare related. 4 bills. I have gotten hundreds of emails about 4 bills. These are and here's the thing. I can tell you those bills numbers and I can tell you what they do. You know why? Because I've gotten so many that I've actually read through them and been like, what is this about? Why are so many people emailing me about this? Grassroots organizations also have the ability to mobilize people and bring them to the Capitol and bring them to the legislature and tell them and tell us legislators what you need. A lot of people don't think advocacy works. And I hate that there's this sentiment that, oh, it doesn't matter if I do that or not, no one's going to listen. That is not true. I can tell you from experience, that is not true. We do listen. Doesn't mean you'll always get the outcome you want, but sometimes you will. But you won't get the outcome if you don't talk to us.
Very well said, Representative Clark. We're at time. So I want to ask my last question with brief responses and a call to action. I'll start with you, Dr. Patterson. What are the most pressing healthcare challenges in Georgia that underserved communities must address through self-advocacy and grassroots mobilization, and your call to action to address this? Brief.
This goes back to what we just discussed, and it is the most pressing issue, I believe, is education, knowledge. Lack of knowledge is keeping us from being able to care for ourselves and seek the care that we need. Of course, not having access to those care kind of make it even more challenging. But the call to action that I would put out there would be for us to show up for ourselves when we have local elections. We need to make sure that we're nominating and electing those if officials that are going to advocate at the state level, at the general level, not just in general election, but the local elections, what I'm talking about, so that they can go forth and advocate on our behalf to get us the access that we need.
Fantastic. Dr. Marsh?
I will reiterate self-advocacy, knowing your numbers. I think one of the biggest issues in Georgia is chronic diseases. The same things that are taking out our communities are being exacerbated by lack of access to care. So if you hear about a health fair, or if you see, any of these other events that provide free health screenings, go utilize them. Even if you have insurance, even if you have a doctor, go utilize them just so that you can keep up with your own health. I think that's the biggest way that you can mobilize yourself, advocate for yourself and your health.
Dr. Clark? Your microphone.
Sorry about that. I think that Dr. Patterson and Dr. Marsh hit the nail on the head. Knowing your numbers, preventative care. I would say one of the most pressing healthcare challenges we have in Georgia is just straight up access to care and access to the ability to afford care or physical access. Like, there is no place for me to go. And I would say advocacy for those types of things looks like coming down to the legislature or finding out who represents you, knowing who those people are, and reaching out to them and telling them what you need.
I want to thank these lovely, lovely panelists this evening for robust, stimulating, dynamic discussion. I am going to finish off before we head over to our host. Dr. Patterson, the name of your business and where can we find you? Please put the information in the chat.
Yes, ma'am.
Healthy Henry.
Healthy Henry.
And we're going to come to you to get our summer bodies right. But we better start now.
Okay, ma'am.
We better start now,
We
right?
have to start now.
We
And
have
I've-
to start now. So let
and
me
I've
go
also
get my
dropped-
last oxtail dinner, my last one, the extra gravy, and then I'm coming. Then I'm coming.
Okay.
I've also dropped some other quick links in the chat for some of our upcoming events. We have Health for Healthcare Professionals Day at the Capitol, where you can come out and meet our legislators and be informed and educated and get some awareness on some of the healthcare bills that are important for us to have discussions about. We have our annual gala coming up. We also have our event at Loudermilk with Black Health Matters, and we dropped the Healthy Henry flyer in the chat as well. And am I forgetting anything? Oh, our update at 8. Tell them a little bit about update at 8. I know we're at time.
I'll get to that, Dr. Marsh. Ask me your MD.
Yes, askmeyourmd.com, where you can get a $35 telehealth consultation rather than paying for any kind of higher copay. We have over 25 specialists that are available for you on your schedule. So we hope to see you.
Fantastic. Cost effective and available. Representative Dr. Jasmine Clark, we're on our way down to the Capitol to make some noise and to educate the people. Where
Look
can we
forward to seeing
find
y'all
you?
there.
Where
Yes.
can we find you?
You can email me. I will put my email in chat. You can also go to my website, which is kind of little talks about like me in the capacity of running for office. So maybe or maybe not. But also, I'm at the Capitol and I am on social media. I will put all of my socials and everything. You can keep up with what I'm talking about because these are topics that I'm talking about all the time. And I would love for you all to follow me if you would like. So I'll put everything in the chat. Thank you so much. I look forward to seeing y'all on February 24th down at the Capitol. Tell us what to do. That's my new campaign. Tell us what to do. Like, it's y'all hired us. Tell us what to do.
Fantastic. And I am Dr. Michelle Nelson, your humble panelist moderator. along with the incomparable Shelly Ann McKenzie. You can catch me every Wednesday night at Updated 8. That is my virtual show, the platform where we discuss all healthcare matters, all healthcare policy matters that have happened the week before. Cruise on over to www.uaprn.org and register, and we will see you every Wednesday night to see what's going on down at the Capitol. With that being said, Shelly Ann, do you want to give a final word before we hand it over to our amazing host?
Thank you, thank you, thank you. Just extremely grateful for the work that all of you continue to do as individuals and the work that we're doing collectively to move the needle. So just thank you for being here, and we look forward to more collaborations. John?
Well, ladies and gentlemen, I want to thank you all so much for joining us this evening, for staying with us for 90 minutes, for an hour and a half. I want to thank my good friend, the Honorable Dr. Michelle Nelson and the Honorable Shelly Ann McKenzie. I want to thank you all both. I want to thank our illustrious panelists, Dr. Marsh, Dr. Pattison, certainly the State Representative Jasmine Clark. Thank you, Dr. Clark. I also would be remiss. I cannot do this work without support. I want to thank our President and CEO, Nancy Flake Johnson, for her leadership. And I want to thank the affable and erudite Kennedy Smith, who's always behind the scenes, but without Kennedy, none of this gets done. I want to thank you, Kennedy. I will leave you with this, although it seems to be somewhat discouraging now, but I think Frederick Douglass once said that power concedes nothing without demand. It never has and it never will. This is a government of the people and for the people and by the people. You, the people, we, the people. And so it's your government. Be heard and be outspoken, and let's do it together. On behalf of the Urban League of Greater Atlanta, I thank you all so very much, and we'll look forward to seeing you next time. Dr. Nelson, when are we gathering for the next time?
When are we gathering? We have our flyer. I don't have all the dates at the tip of my fingers, but if you cruise on over to the Urban League website, Mr. Moy, that web address is
www.ulgatl.org.
If you look under events, you will see a flyer that has
May 20th.
all of our dates.
Thank you. May 20th.
Okay, wonderful.
Is our next
all of our
gathering.
dates for the rest of the year.
Yes.
So we want to see you. You go ahead and save the date and make sure that you're with us every single time. We're here to serve. We are here to serve. Mr. Moy?
Thank you all very much. Have a good evening.
Thank
Be
you.
well.
Thank you for having us.
Thank you, and keep the faith.
Thank you so much. You too.
Thank you, panelists.
Thank you, Dr. Nelson, for having us. This was great.
Thank you.
Until next time.
Until next time.